Alan Tagati is on a ventilator and in intensive care. This also puts him at an increased risk of developing an ICU infection.
There is an additional perhaps 10 to 15% mortality risk associated with acquiring an infection in the ICU. Therefore, strategies to try to prevent that, to treat it effectively and early, assume a substantial degree of importance when you look at this as a global health problem.
Dr. John Marshall of St. Michael's Hospital in Toronto, Canada, along with fellow international co-authors of the study, examined data from 1,265 ICUs in 75 countries over one 24-hour period in 2007. The study, appearing in this week's JAMA, Journal of the American Medical Association, found more than half of the over 14,000 patients in ICUs on that one day had infections.
60% of the infections were pneumonias, about 20% were infections inside the abdomen, and about 15% were infections of the urinary tract.
The study found that patients who stayed in an ICU 7 days or more had an increased risk of also becoming infected.
One of the things that this study actually allows us to do is to begin to get a sense as to how much of the burden of infection is an added burden on a patient who is already at risk of dying because of the underlying diseases that led them to be in the intensive care unit.
Catherine Dolph, The JAMA Report.